This is a demonstration of clinical palpation for physiotherapy practice. In palpation for the neck, we call for anterior side first before the posterior side. Same as other body part, we come with some hypothesis before we start the palpation. So we bear in mind whether the possible problem is due to the joints, muscle, nerve, or other structures. To start with the palpation, my practice, I usually will still feel the superficial muscle first. Then I use the thumb and the finger muscle to check the tenderness, any tenderness on the scalene sternocleidomastoid muscle. At the same time, I observe the breathing pattern, any overuse of accessory muscle, any pain here. Okay. After that, I can check the upper trap muscle as well. On here, any tenderness, one by one. Upper trap muscle line from the shoulder all the way to the neck. Sometimes it's like the neck side bend or neck extensor. So we also can use our fingertips to feel the upper trap muscle and tenderness. Okay. Also the joint and the posterior side, one by one. Then mainly for the anterior side, okay, we can do some anterior posterior accessory movement. So we snap from our side, lateral side, to snap up some soft tissue first, and then go in the anterior posterior translation to see any joint stiffness, dysfunction, or localized pain. You make sure when you snap up, don't chop the airway or don't press on some sensitive soft tissue. Because only anterior posterior translation, we can check up to the upper cervical C1-2, which is just next to the ear and behind the jaw, the TM joint, okay, here. So for cervicogenic headache, it is very important to feel the C1-2. This anterior posterior. And sometimes the joint stiffness dysfunction also can be from the lateral side. We use a lateral to medial force to check it as well. So three surface, AP, anterior posterior, lateral to medial, and PA after turning around, PA side as well. For example, if for cervicogenic headache, you can see the C1-2 AP. For the discogenic neck pain acute, we can see also AP C4-5-6 is more prominent here. For resting outlet syndrome, we can check the first rib, sternocleidomastoid muscle, and the scalene muscle. Okay, so those are the demonstration for clinical palpation for the neck.